Hi, Dr. Memark.
Hey, good evening. Thanks for having us tonight to give you our COVID update tonight. So we'll start off with our general numbers and the state of COVID in our county right now. So as always, we start off with our general numbers with over 72,784 cases of both the PCR and antigens. Per 100,000, that puts us at about 244 cases per 100,000. Those of you that are following, we have kind of plateaued at this number in the mid twos, about 200s. And remember, that is about 2.5 times higher than what is considered to be high transmission. So anything over 100 cases per 100,000 is still considered to be high. When you see that epi curve on the right, you can see that the tremendous surge that we had in January, and then how it's kind of slowed its slope a little bit as we've entered into March and now at the end of March. And when you look at the positivity rates of folks that are getting tested, it's at about 5.3%, and that's pretty good. Remember, the 10% mark of tests that come back positive is a concerning number for us all. So we watch that pretty carefully, but right now that's holding pretty steady. When you look at the number of deaths that we've had, we've continued to have deaths that are trickling in, although it is slowing down. When you look at the number that we have here at 891 people that we have lost to COVID in the county, when you add in the antigen numbers, which are those tests that we get back quicker, about 30 minutes, that actually puts us at about 965 deaths in Cobb County. And so a lot of lives have been lost. It has been slowing down. We did have some that came in from the weekend and early this week. And this is just to remind you of what we've been seeing. And so we have seen the transmission rate has been continued to be high, but has leveled a little bit, and positivity remains about 5.3%. Hospitalizations are fluctuating a little bit at this point. This last few days, we've seen kind of a tiny uptick that we're watching very carefully, but it does seem to fluctuate. But it has not been steadily going down. So we're watching that very closely. And we have had a lot more contacts and cases that have been reported to us. And so we're definitely watching that right now. So this is the topic of the day, is that the stage of our pandemic is the variants. And so we have multiple variants that we're keeping an eye on throughout the nation and here in Georgia. Georgia has been reported to have multiple variants that have arrived. And so the largest one that we have is the B117 UK variant. And so we have 351 cases throughout the state for that one. And then we also have the P1, the Brazilian variant that has arrived in Georgia, and the B351 South African variant. We're up to 15 cases. There are some of the California variant as well. It's unknown kind of the impact of the California variant, but we definitely are seeing a rise in the number of variants. Remember, right now, it is estimated only about 2% of tests are being sent for variants. We were kind of getting cases between 6 to 9 cases a week. And last week we received 17 cases of variants, and we're up to about 47 cases. I just got a few more that came in for Cobb County. And so that includes all the variants. There's 3 variants that we have that are being tracked. And so the concern for the variants is that the contagiousness of the variants are thought to be increased compared to our normal COVID-19 that we see, that it spreads more quickly. And the UK variant, there is some data to suggest that it is associated with increased risk of death. So this is quite concerning for us because as we are trying to get these vaccines out, we also have variants that are trying to take hold within our communities. The good news is so far, it looks like that antibodies that are produced after the vaccines are helping against the variants. And so there's more data that needs to be collected. This virus is very smart and changes on us. But right now, there does seem to be some effectiveness in antibodies that are produced. We continue to have testing in different areas, and want to make sure everybody knew that. We have multiple areas that offer free testing options, and we have the Mako testing in Jim Miller Park that does collect insurance, but it is there's no cost to you, and it is still, if you don't have insurance, it's still free. Test results are coming around very quickly. So remember, I was on a couple of calls today that allergy season is upon us. And so, it's very difficult to tell the difference between allergies and whether you have COVID. And so, first of all, if you are been in contact with somebody that has COVID and you develop symptoms, there's a higher risk that you could be having COVID-19. And on the other hand, if you are like my son who starts sneezing the second he wakes up and then takes his allergy medicine and then it goes away, there's probably a better chance that you have COVID-19. And I mean, not COVID, you have allergies, not COVID-19. And if you're missing some of the other symptoms that we know come with COVID. So this is a difficult time it's going to get a little bit murkier about how to tell the difference between COVID and allergies. So please use your best discretion on that. And if you're having symptoms, try to stay away from folks to be on the safe side. So vaccines. So we continue to roll out the vaccines, and we anticipate at the end of this month, and that's just next week, and early next month, we should see a really big increase in vaccines that are coming to the state of Georgia. So we've done over 3.2 million in the state, and in Cobb County, 182,000 vaccines have been given thus far. We're all trying to migrate over to the state system for appointments, and you see the website right there. You can go ahead and log on and go for appointments. So for us at Cobb and Douglas, we will be releasing some appointments sometime tomorrow. And we always make sure we have the vaccine that's coming to us before we release any appointments, because we don't want to cancel on folks. So we'll release appointments for next week, and you'll be able to do that sometime tomorrow. But you can also go to that site and choose any site. There's mass vaccination sites that'll be at Lake Point, and I heard Mercedes-Benz has a lot. They're doing probably at least 6 to 7 times more than we do daily. They're doing a big push right now to do over 6,000 vaccines a day for a few weeks. So definitely some availability there as well. So you can see over our Cobb and Douglas site. I hope many of you have come to see us. We've done over 43,000 vaccines over there, and we been trying to work with Cobb seniors mostly, and we have new appointments every week that are opening up. And so we had a very successful vaccination effort with our Cobb schools, and did very well with that, and have another one coming up this Friday as well. And so look forward to vaccinating as many of our folks as we can. So, we got a lot of folks that, that's still kind of thinking and waiting on the vaccines. And, one of the things that does keep me up a little bit right now is the folks that don't want to get the vaccine. And so we do see kind of like this wave after eligibility opens up, and then we see kind of a fall off of folks that don't want to get vaccinated. And today, I heard my my epidemiology reports, and we still have some cases that are coming in through nursing homes as well. And so there are folks that are still opting not to get vaccinated, and everybody has their reasons, but I wanted to make sure that everybody knew kind of the benefits of getting vaccinated. So we know, first of all, we have some very, very good vaccines. If we had flu vaccines that were this great, I think that would be awesome. But we're lucky that COVID vaccines seem to be very, very effective in preventing symptomatic COVID. Even if it doesn't halt your transmission, the fact that it can almost 100% of the time prevent serious illness and hospitalizations and deaths, that is absolutely amazing. And the people that I know, the people who gotten vaccinated, you may have a few days of some side effects afterwards, but I think we're all doing pretty well now that we've all gotten vaccinated. You're going to protect others, and then this is what's getting us towards herd immunity, is that we get vaccinated. Just like we get our flu shots, we get the COVID shots as well. You can start letting up on some of your restrictions about wearing masks and stuff if you can be around other vaccinated folks. And you can also visit some unvaccinated folks that are at lower risk. So, it definitely gives you some more opportunities. And you don't have to be quarantined if you are vaccinated and asymptomatic. So these are really important things that are going to get us back to normality, but we all have to do it as a community together to be able to make this work. If we're only at 50%, then it means that there's still going to be 50% of folks that are out there that are at risk and can continue to pass it on. So definitely some things that we need to consider as we move forward. Breaking news. So, if anybody has seen today, the governor said, and so we have all Georgian residents that will be eligible as of Thursday. So, 16 years of age and older. So, remember, 16 to 17, 16, 17, you're only able to get the Pfizer vaccination. And so, we are giving Pfizer out at Cobb and Douglas Public Health at both of our locations. So, Pfizer is given there, but now it is open season, so everybody that can get a vaccine is eligible now. So 16 and over. So you can go to the DPH website. There's multiple sites. If I were a person looking for a vaccine right now, I would go to the DPH website, and a lot of the sites are on there, and I would look at those GMA sites. The GMA sites are getting vaccines on the side to be able to help and bolster. They're trying to do a big push the next few weeks to make sure that as many folks get vaccinated as possible. And tomorrow our website opens up as well, and you can grab some that are nearby as well. All right, I'll turn it over to Lisa now.
So as Dr. Memark was saying, this is just a screenshot of our Cobb and Douglas Public Health website. You can go on here and click on this. It'll take you to our state registration system. And there you'll be able to choose a location within a certain number of miles of your zip code that you prefer to travel. So this is a great way to find available vaccine. Also, if you go to the DPH website that Dr. Memark mentioned, you can search the vaccine locator, and you can log into the county that you want to participate or that you want to visit to get vaccinated. It will list all the eligible providers in that location. And then they have active links to be able to go to their site, and it gives you instructions about whether to connect to their appointment system or to call them or to visit their website to make an appointment. And please remember that you do not have to get vaccinated in your home county. You can go anywhere that it's convenient for you and where there's open appointments. This is also just some other screenshot choices on the Georgia Department of Public Health website. It helps you not only find public health locations to register for, but we have all of the retail pharmacies that are available to you. And you can click on any of these live links and be directly connected to those retail pharmacies and make appointments there. It also allows you to go to My Vaccine Georgia and make appointments with the Georgia Emergency Management Association web locations. So kind of a one-stop shop. You can go to that one location and find links to whichever sites you'd like to go to get vaccinated. And then I get to share exciting news. As of this week, we got our mobile health van. These are some pictures that we took today of the new van. With special thanks to Cobb County Community Development Block Grant for helping to fund this. We'll be able to use this van with our outreach team to go around to different parts of Cobb County to provide mobile satellite vaccination efforts. I also wanted to mention, as Dr. Memark was talking about our testing sites, we're going to be converting some of those satellite testing sites to vaccination and testing in the coming couple of weeks to be able to help improve access in some different geographic parts of the county. And then I just want to really give a shout out to Cassie Masloom and Kimberly Lemley for helping us with the call center. And thanks to the commissioners for approving that. It's making great progress, and I think the team is expecting to be able to launch that call center at the first week of April. And man, it just couldn't come at a better time with now opening up all of these vaccine eligibility options. So we really appreciate that support. Final takeaways, just more vaccines are coming in, as Dr. Memark mentioned, in the next few weeks. Please take whatever brand of vaccine that you have access to. All of them are excellent. So the idea is whatever vaccine you have access to is the right vaccine to take. There should be lots of appointments opening up with more than 2,700 providers across the state. We do recommend that you still practice these prevention techniques. to help reduce the spread until we can reach the herd immunity of wearing your mask, watching your distance, washing your hands, and limiting the gathering outside with other households. And so please do that, but please also look very diligently about trying to get vaccine. It will help all of us. And I'll stop there, stop sharing, and we'll see if there's any other questions that anybody has.
As always, thank you for that presentation that you provide us at all of our Board of Commissioners meetings. It's good to see that our rate is continuing to go down, but also appreciate the word of caution that we still have a high level of transmission compared to the benchmark of over 100,000 cases being that demarcation of where we're in high transmission. So I think it's important that we continue to still be cautious as we see the numbers go down until we get beneath that threshold. Commissioners, do any of you have any questions? One question, I know with the breaking news, I think I was so excited to see that can you remind me of the date of when it's available to 16 and above?
Yeah, so Thursday, right, Lisa, will be when they start. So it kind of works out nicely because we release our appointments tomorrow, and so we'll be able to book those and keep them, we'll have them open to whoever is eligible at that point.
Thank you. And are your number of vaccinations or vaccines going up compared to weeks past?
Yeah, we definitely have been able to increase those, and so depending on staffing, we can definitely take those. But they have been also giving out more vaccines to our partners as well. So it's been a community effort to get all of our folks vaccinated.
Okay, great. Well, thank you again. We appreciate your time, again, every Board of Commissioners meeting. And ask for the public to continue to exercise caution with the points that they shared about wearing your mask, keeping your distance, limiting your time outside of the home with social gatherings, and we hopefully will continue to see these numbers go down. Thank you, Dr. Memark.
Absolutely.
Thank you, Lisa.